therapists and teachers at Misericordia south of Chicago are using simple electronic switches in a new method of intervention for multiply handicapped individuals. Misericordia is a skilled care nursing home for severely and profoundly retarded children that are nonverbal, non-ambulatory, and dependent on others to provide all their daily care. In the past, these children have had little control over their environment. Even in therapy sessions, they maintained a passive role. A therapist would present a variety of sensory stimuli and wait for the children to respond. Often their responses were so subtle, they went unnoticed by the therapist. Today, the use of switches is being integrated into many existing therapeutic and educational programs, enabling the therapist to provide more consistent reinforcement for the children's responses, and enabling the children to take a more active role in the therapeutic process. In addition, the children are learning to play independently and control their environment in ways not before physically possible. Switch use has become popular within the past 5 years among clinicians working with the severely handicapped due to nationwide workshops on active stimulation programming given by Dr. Edmund Zaromsky, and through books on how to construct homemade switches published by Laura Burkhart of Maryland. These switches are inexpensive to make and easy to use. Some switches made for less than $5 are activated by applying pressure. They can be made sensitive enough to require only a light touch. Mercury switches are activated when the tip is in the upward position. Velcro strips are used to mount the mercury switch for activation by any body part. Velcro attached to a hat is used to mount a mercury switch to a child's head. These and other switches can be used to activate most any toy. Switches plug into tape recorders at the remote jack. Switches are used with battery-operated toys. An adapter is inserted into the battery compartment of the toy, and the switch is plugged into the adapter. Electric toys and appliances are modified for safe use with an AC adapter. The toy and the switch plug into the adapter, ensuring that only battery-strength voltage passes through the jack. At Misericordia, switches are used in the remediation of self-stimulative behaviors, as well as in the programs for motor, cognitive, and language development. Hand-mouthing behaviors are discouraged by placing a switch where it will give the child reinforcement for keeping hands down. With children that demonstrate a variety of self-stimulative behaviors, the therapist uses switches to redirect the child's attention and to increase their interaction with the environment. Switches used for motor development are made specifically for the motor skills to be trained. For example, to develop reaching and grasping skills, a pull switch is suspended near the child's dominant hand. When the child grasps and pulls the switch, the toy turns on. For children that demonstrate random and infrequent batting skills, a mobile switch is suspended so that a toy will turn on when the child makes contact with the switch. Switches are used with children that have difficulty bringing their arms toward midline. They are positioned in a side lyre, and a mercury switch is fastened to their arm. The child is reinforced as he brings his arm down and toward his midline. In programs to improve head control, the position of the mercury switch is dependent on the ability of the child. If the child can raise his head only 30 degrees, the switch is attached near the back of the head, where it will be sensitive to these subtle movements. If the objective is for the child to raise his head 90 degrees, the switch is placed at the top of the skull, and the toy is positioned to be at eye level when the head is elevated 90 degrees. With children that are athetoid, two switches are used together to improve stability. The switches are positioned facing one another, so the toy will turn on only when the head is in the neutral position. Switches used in programs for cognitive and language development are positioned where they will be easiest for the child to operate, For example, if the easiest movement for a child is neck flexion, a switch is positioned under her chin for activation by this movement. In cognitive programs, children are being taught that they can cause changes in their environment. To train this awareness of cause-effect relationships, baseline data is first taken to determine the frequency of a specific movement, such as head turning. Then a switch is positioned for activation by this movement. The child is taught to activate the switch for the reinforcement toy. The child has mastered this skill when he demonstrates 60% more head turning while the switch is in position than when it is not. Children that have awareness of cause and effect are then given 2 switches and taught to discriminate which switch, if activated, will turn on the toy. The teacher takes data to determine if the child activates the live switch 60% more than the switch that is not connected. The switches may be used to train children to identify pictures and activate the toy named. A child given only 1 toy and a switch that is easy to operate is taught to follow a 1-step command.
Stop, John. Turn it off. Good listening. Good listening.
The switches are also being used to operate simple communication systems, such as the dial scan. Initially, the child learns that if she stops the dial on the picture, she will receive that toy. Later, 2 or more pictures are used to provide the child with a variety of toys and activities from which they can choose. The skills learned through switch use are now being applied to more complex tasks, such as augmentative communication systems, as well as electronic wheelchairs. The switches in therapy program at Misericordia South is effectively utilized by 40% of the children, giving them greater control over their environment.